We will start with knot tying. First knot is simple knot. First, make sure the left string is on top on your right string. Why? Because it's more stable and it won't tangle. And then now hold the string like this, turn it over, approximate your index and thumb, go into the hole, take the string down the hole, tight. And then part 2 is also the same thing again. Okay, now we go to the second note, reef. Reef is consisted of 2 parts. First part is the same one first, and then part 2 is put the string on your thumb and then cross the string, approximate your index and thumb, take the string up to the hole and tie. Okay, done. Note number 3 is surgical note. Surgical note consists of part 1 and part 2. Part 1 is same thing, crossover, and then here we approximate index and thumb, go inside the hole, take the string and go downwards again. Okay. Part 2 is same again. Okay, now we are doing modern type of note. It's for emergency case. Hold the string like a rabbit. Okay, then pull your hand down, put the string on your phalanx. Third finger push the string inwards, then outwards the other one, then tight. Same thing again. Inwards, outwards, then turn and tight.
The first method of holding your scalpel is table knife method. It's held like a butter knife, where the point is facing outward and the handle is pressed against your palm. The method of incision is 90 degrees, 45 degrees, and ending with another 90 degrees upwards. The next method is pen method. Scalpel is held like a pen and is done for precision cutting. The other method is fiddlestick method. Fiddlestick method. This method is used for superficial cutting, like so. And the next method, the last method, is amputative method, with the blade facing towards you, and the method of amputation is so. The hemostasis is done by the help of the assistant, giving the head surgeon the hemostatic clamp. This is the hemostatic clamp. It is held like so, with your thumb and your fingers in between, in 90 degrees direction. The nurse, the assistant passes the head surgeon the string while supporting the clamp. The surgeon then ties a simple knot around the vessel, while the nurse lifts down the clamp for better. While the assistant lifts down the clamp for better viewing. Once the first knot is tied, the surgeon will ask the nurse to let go. And then the second knot is tied, like so. Once this is done, the assistant cuts the string. The method of charging a needle is done like so. At the 1.5 quarters, 1/3 of the needle length, it is fixed. the string is passed through the hole like so. And the length is approximated to 1/3 and 1/4 and 3/4 of the length, like so. The skin fold is made. The skin fold is made approximately 1 centimeter or 1.5, not more than 2 centimeters in length. Suturing is done in a rotating motion, like so. Needle is then fixated until you hear a click. The next fold is made at the same length, 1.5 cm and not more than 2 cm. Needle is held perpendicular so that it is in a linear, in the same line, in parallel lines. And suturing is done in a rotating method. It is the assistant's job to tie the sutures together. Using surgical forceps, the skin is approximated together by the assistant, like so. The string is cut with the scissors facing towards the surgeon so that the length about 1 centimeter is approximated and cut, like so.